Welcome back to Pulse Education. My name is John Carrico. Thanks again for joining us. Hopefully you have been following along in our series of videos that we've been doing on taking a disciplined approach to 12-lead interpretation. And specifically the last few videos, and this one included, are specific about axis determination. And you may be wondering why we're spending so much time in so many videos specifically on axis and all the nuances of axis determination. And the thing is that I promise you, if you know how to use axis and how to apply that to interpreting a 12-lead, it will pay dividends for you, especially when you have more complex cases or you have 12 leads that when you see them, there's a lot of things going on with them. It is going to help you tremendously in properly interpreting your 12 leads. So that being said, this video is on right axis determination. Thanks for joining us. Let's get into it. So as I said, we are in this series of taking a disciplined approach to 12-lead interpretation. We're on step 2, axis determination, and today we're talking all about right axis determination. We've talked about normal axis and left axis, and today is all about right axis deviation. And I'll tell you this, I'll start off with this first and foremost, that when our patient has a right axis deviation, that is always pathological. There aren't any normal cases for adults to have right axis deviation. There's some sort of pathology that is creating that. The only instances where this is going to be normal typically is in our juvenile population, in younger children who are still, their hearts are still developing. So it may be common for them to have right axis deviation. That may be a normal finding. But in our adult population that we typically think of when we're typically doing most of our 12 leads on, right axis deviation is always going to be pathological. We just have to determine exactly what those pathologies are. So again, with our normal axis, we talked about, we've really diagnosed and gone through what depolarization is supposed to look like in our conduction pathways, okay? And when that happens, we have that typical depolarization pattern or depolarization wave, and it starts up in our right atrium and finishes down here in our left apex of our left ventricle. And we've kind of talked about that a lot. So now we're talking today specifically again about right axis. And what's happening in our right axis, remember, axis is all about the average direction that depolarization is happening in the heart. In terms of if we are to average out all those little myocytes in the direction that they're firing off. So in the case of right axis deviation, right, that our depolarization wave, it takes a turn, right? The average direction takes a turn toward the right ventricle instead of continuing on toward the left ventricle. And that in itself is, again, like I said, pathological. So typically what we're seeing is when we look at this, we're going to be able to determine that our axis, okay, is going to switch from being an average of 0 to 90 degrees to now being from positive 90 to positive 180 degrees. So anytime when we get our 12 lead back and we're looking at that and we're looking specifically at our axis and we see that our axis is in between that 90 and 180, that in itself is going to tell us that we're dealing with right axis deviation for our patient. Okay, you can see here again, here it is kind of what we're kind of dealing with here is that as depolarization makes its way down its conduction pathway and down into the ventricles, the left ventricle typically will be very normal. But for whatever reason, and most of this is going to be because of an increased demand on the right side of the heart, that's going to pull the average direction over to that right side. So more of the myocytes are firing in that direction toward the right side. Sometimes that's because there's more myocytes on that side. Sometimes because there is increased demand, the right ventricle has to work a lot harder than it normally is. And we're going to take a look at each one of those coming up here. So if you can imagine, I'm going to draw on here real quick. Our right ventricle, for the most part, okay, our right ventricle we don't ask a lot of it. It doesn't have to do much. It's a low pressure system. Really all that it has to do is squeeze blood from here through the pulmonic valve into the pulmonary arteries and to the lungs. It's not very far that it has to do. And so those typically, we don't ask a lot of that. Again, it's that low pressure system. In some cases though, we're going to see that suddenly, either acutely or chronically, that the right ventricle is having to do a lot more. So for example, let's take that we have a pulmonary embolism up here in our pulmonary artery, okay? We have a blockage up there. So When we have that blockage, the brain is going to tell that right ventricle, hey, we need to hyperperfuse our lungs. Our lungs aren't getting enough perfusion. So the right ventricle, which is normally like chilled out, not having to do much, all of a sudden is asked to do a tremendous amount of work. Okay. And so in doing that, we're going to start to see that a reflection of all that workload is going to be reflected in a right axis deviation. It's going to pull that average direction of depolarization over to the right side because it's working tremendously harder than it's supposed to. All right. Another example would be when we have narrowing of our pulmonary artery, constricting of that pulmonary artery. And that usually is most often associated with pulmonary hypertension. So just like a garden hose, if we narrow that, if we constrict that opening, right, then we know that it's going to take more pressure to get our blood and our volume through that. So as that narrows down with people, especially who are having pulmonary issues that can lead to pulmonary hypertension, we're going to have that constricting of that pulmonary artery, and the right ventricle over time is going to have to work harder and harder and harder to get blood through that narrowing, okay? And that chronic over time working harder, all right, typically will cause this right ventricle to get bigger and bigger and bigger, and that's what we refer to as ventricular hypertrophy. The muscle is getting bigger and bigger and bigger because it's more demand is made over it chronically over time. Okay, so those things can all lead to that right axis deviation because suddenly there's either a lot more myocytes on the right side, or the increased demand is pulling that average direction toward the right side. So the main causes of our right axis deviation, some of which we already mentioned here. So we can have acute pulmonary disease, right? So thinking about, again, something like a pulmonary embolism, all right? Something that happens acute and puts a lot of stress on the right side of the heart. We can have chronic pulmonary diseases. We typically think of our COPD patients or even our pulmonary fibrosis. Any patient who has very chronic pulmonary issues is potentially can create that narrowing of that pulmonary artery that can lead to pulmonary hypertension. As I mentioned here, right ventricular hypertrophy is another leading cause of right axis deviation because of those added myocytes within that right ventricle is getting bigger and bigger and bigger versus what we're seeing on the left-hand side of the heart. And then we can also have some conduction issues. So we can see a blockage or where our left posterior fascicle, so that's one of the fascicles of the left bundle branch that is no longer conducting, and that can cause right axis deviation. Hyperkalemia, especially as that potassium increases, it gets higher and higher, can cause conduction issues. And one of those common conduction issues with hyperkalemia is right axis deviation. And then, as I said, it can be a normal finding in our younger children and our younger population. All right, so all causes of right axis deviation. All right, but I would say 90% of the time it's going to be because of that increased right ventricular demand, typically from our pulmonary issues or something like a pulmonary embolism. All right, our conduction issues we do see. It's a little rare for us to see those things, and we will talk about those in some further videos as well. All right, so again, we've kind of gone over this slide several times here. If we have our normal depolarization wave, right, we know that if depolarization is moving towards one of our leads, then we're going to have a positive complex, a positive QRS complex. So in our normal depolarization, as we've talked about, our lead 1, 2, and 3 are all upright because depolarization is more or less moving in the direction of those leads. However, in our right axis deviation, because the average direction is moving toward the right ventricle, we can already see that it's moving away and more toward some of these. So in lead 3, we can clearly see in lead 3, right, that depolarization is moving toward lead 3. It's clearly going to be upright. Its QRS complex is going to be upright. Lead 2 typically will also be upright just as it's moving towards, more or less towards the inferior part of the heart where lead 2 is as well. But we can clearly see in lead 1 that depolarization is moving away. That average direction is moving away from lead 1. Okay, so our hallmark sign in terms of our our different leads is that lead 1 is going to be negative. All right, the QRS complex will be negative or a downward deflection in lead 1, despite lead 2 and lead 3 being upright. So anytime we see that big S wave, which reflects that negative deflection in lead 1, all right, we have to assume that we're dealing with a right axis deviation, specifically if lead 2 and lead 3 are upright. All right. The other way that we can also look at that, obviously, and we talked about this, is our right axis deviation. If we look at our degrees, is going to be between positive 90 and positive 180. So if we're looking at the numbers that our 12 lead is going to generate for us, we're going to look at our QRS axis, and in this case, you can see this one says 100, all right? And if we look at over here at our leads 1, 2, and 3, you can clearly see that lead 1 has a positive or a negative deflection, okay? The other thing to think about that in lead 1 is normally a completely positive deflection. So even if this is kind of more biphasic, our lead 1 is a little bit more biphasic, as long as the negative part of that complex is greater than the positive part of that complex, that will generally indicate that this patient's in right axis deviation. I've been referring to this chart in some of our previous videos, and we're kind of building along to it here. This chart is very handy to have along or refer to, and you can see now that we've added onto it our right axis. Again, positive 90 to 180 degrees. Lead 1 is going to be negative or downward deflection. Lead 2 and lead 3 are going to be positive deflection. That's going to be hallmark for our right axis deviation. Okay, so let's practice this. Let's look at a couple of these examples, okay? So starting at the beginning of using our disciplined approach, so the first thing we need to do is rate and regularity. So we look at our rate. Our rate here is 96. We look to see if it's regular or irregular. And in this case, everything is marching out. We have a regular rhythm here. Then we'll move on to our axis. And we look at our axis, and I can see here that my axis down here says 113, okay? That's above 90, between 90 and 180. Or if I look at my leads 1, 2, and 3, we can clearly see that lead 1 is a negative deflection, and lead 2 and lead 3 are positive. So we have right axis deviation in this regards. Another good example here, again, start with rate. Our rate is 125. That's a pretty fast rate, okay? Not necessarily usually fast enough that we have to do an immediate intervention, but we're concerned about a rate of 125. We look to see if it's regular or irregular, and in this case, it marches out in a regular beat. So we have a regular rhythm at a rate of 125. We're going to do our axis determination now. Step 2, we look at our number. It says 95 degrees, and I look at my leads 1, 2, and 3 to confirm, and we can see that lead 1, all right, and I'll blow this up a little bit here. Lead 1 is not fully negative, but there's a greater or a more majority of the QRS deflection that is negative than is positive. And again, that's going to indicate to us that we're dealing with a right axis deviation, especially because lead 2 and lead 3 are both positive complexes. And our last example, just to drive this home real quick, again, rate and regularity first. We look at our rate. This person has a rate of 98. Looking for regularity, it marches out. They've got a regular rhythm right now. So everything with that looks good. We go to step 2, our axis determination. We can see on here 106. Okay, so that's clearly between 90 and 180 degrees. And then I can also look at my leads 1, 2, and 3, and we can see that lead 1 is indeed negative, and lead 2 and lead 3 are positive. Okay, so remember that, one, it's very important for us to determine axis, and then in this case, our right axis, and then remember what the causes are, right? That typically our causes are going to be pulmonary issues or pathologies related to pulmonary issues, or potentially acute pulmonary issues like a pulmonary embolism. Our other things could be from conduction problems, like a posterior hemiblock, or because of the patient being hyperkalemic, all right? We're going to break down some of those different issues in some videos ahead of us, but just knowing how to determine right axis and knowing what some of the causes are, I promise you, are going to pay off and pay dividends as you move into more complex cases and as you take care of patients, okay? So remember, in terms of stay disciplined with your 12-lead approach, it's going to help you tremendously. We have one more video on with our axis video series, and we're going to talk about extreme axis deviation and some things that indicate potentially for ventricular tachycardia. All right. Thank you so much for joining us. As always, we really hope this is helpful. We're having a lot of fun with these videos. We've gotten a lot of great feedback from people. Keep it coming. We'll make sure to keep the videos coming as well. Like, subscribe, give us some feedback, and we'll see you on the next one. Take care.